Yo, what up? It's a tip of the week, and today we're going to discuss how to manage a patient when they're calling after an extraction and they say they're having swelling. Alright guys, if you're new to this channel, I'm Dr. Jared Williams. I'm a concierge dental surgeon in Houston, Texas, and I've completed about 10,000 surgical cases, working with about 30 different dental practices, and been practicing for about 10 years. And the reason why I created this channel was simply so that you can smile after surgery. In my basically a decade or 10 years of practicing, I always try to figure out how do the best stay at performing at such a high level. And so after my quest of knowledge and experience, I wanted to share these tips and tricks with you so that you and your patients and your staff and your family and your CPA can literally smile after surgery. So if you want to learn more about how to manage a patient when they're calling you and they have swelling, this is the video for you. All right, so what I want you to do is this. Hit the like button, subscribe, smash the share button so that your friends will know, hey, how to smile after surgery. All right, so let's jump into it. All right, number one is this. Anytime one of my patients called me and they're saying, hey doc, I'm having some swelling, I'm having some issues or pain, what I first do is I panic. I don't know why after 10,000 cases I still do this. Well, I'm gonna say panic, but I'm just like, oh crap, here we go again. And it sucks because it's like, I don't know about you guys, but I'm a perfectionist. And that is to my detriment at most times, especially my gut motility, because it's just like, I just want to do the surgery, allow the patient to have a great result, and then let them go. And I don't have to hear from them. Not because I don't want to hear from them, but because, after you do things so many times the right way and you learn from the best, there is a high expectation that when you do something right the first time, you won't have to do it again. And so when I get that beloved phone call, that beloved text, or the patient's like, hey, how do I manage? I'm like, all right. So I'm gonna share with you these 3 tips on how you can literally do the same. All right, so first thing is this. Let me give you my post-op instructions and you should kind of follow through. So number one is this, before I get into the tips, I always let the patient know, no rinsing, spitting, or using any straws. And I literally demonstrate to them, no rinsing, spitting, or using straws. And I'll do this, no rinsing, spitting, or using straws. And by doing that, most patients do just fine. Now just know that anytime you do hypo extractions, patients who are gonna have the most issues is gonna be any procedures that are on the lower jaw, simply because of the vessels that are in the lower jaw. They tend to be a little bit more dense, which means if the bone is more dense, there's going to be less blood flow to get to those areas to give it nutrition and allow it to just heal nicely. And if you have a dry socket, by doing rinsing, spitting, or using straws, then that's going to dislodge that site and give you alveolar osteitis. There's another video I created to go so much more in depth, but I just wanted to give you an overview. So with that being stated, I let the patient know they could eat whatever they want. Now I know there have been individuals out there that say don't eat popcorn, don't eat, I don't even care. Like honestly, it does not matter. After 10,000 cases, I think I know a little bit about what's going on. And so I just tell the patient, hey, if it hurts when you eat it, then don't eat it. And most patients, they get it every time. Now, I have a handful of patients that will have some pain, and typically when that happens, it was going to happen regardless, so I just kind of live it up. But my main thing is allow them to take the medications, don't do anything silly like rinse, spit, and then, they should be good. All right, but when they do call me, I will get their phone number and I'll ask some questions, like some open-ended questions. So tell me what's going on. And by asking that question, I don't want to pump them full of information. I want them to give me the information. This way I can determine what's going on. If you ask a open-ended question, you're going to get way more information than if you ask a leading question. Now, you guys that are out there that are married or in a relationship or anything like that, when you go with a leading question, you're screwed. I don't care what's going on. But you ask an open-ended question, you're going to get more information. So hint, hint, all you gentlemen out there that are either married and your spouse and you want to get some information, don't lead. Ask an open-ended question. And I know you ladies out there, you could tap me on my back and let me know, hey, thank you for speaking to my spouse. But yeah, ask open-ended questions, because your patients are generally going to want to give you more than what you gave them. So it's kind of like this. If I were to say, hey, Ms. Jones, so tell me what's going on. How can I help? And that's what I ask every time. They're gonna say, well, doc, you place this implant. I'm gonna give you the exact scenario that happened this early this week. So doc, you place this implant on my jaw and it feels like you broke my jaw. And I'm like, broke your jaw? Now, when typically my default implant is gonna be 11.5 by 4.043. And typically speaking, 11.5 implant is going to be basically the root size of just about any implant, any tooth. So me fracturing the jaw with 11.5 millimeter implant by 4.5, probably not going to happen. Probably never going to happen, but I'll just say probably not going to happen. And so when I evaluated her, I was just like, okay, tell me what's going on. And so she's telling me what's going on. She told me that when I was working on her, she heard, and she was just like, I thought that was a fracture. So I was just like, all right. So what I did is this: I had her, I asked her about her pain. I was like, so tell me what's going on with your pain. And she was just like, well, it was on 2 days after the procedure was at a 10, and then a day after, at the third or fourth day, I'm at a 5, she said. So I was like, okay, good. So the pain scale went from a 10 down to a 5. And prior to the procedure, I also asked her, I was like, hey, I also let her know, hey, you're probably gonna need a soft tissue graft, because when I sutured, I had to take a piece of the cheek to the lingual side just so that I could get some primary closure. And so that gives you heads up. So I didn't do any fracturing of the jaws. Like, thank you very much. And also did some inspection when I saw her. But anyways, I did that. And so, I had her take a picture of her face. And what I did is this: I have her get a selfie and do one of these and take a picture. And what that does is allow me to see the symmetry or any asymmetry, any swelling on either sides. And by doing that, that's a lot of information. And so once it comes to my phone, I can look at it and say, okay, what's going on? Now, the reason why I do this is because as a concierge general surgeon, I'm not always going to be in a position to go to somebody's office and be like, hey, let me come and see your patient, because some days I'll be 30 or 40 minutes away, or I'll be booked solid with a bunch of surgeries, and I just don't have the latitude to just open up my practice if I have my own practice. And I like it that way. You know what I mean. But I like to have the ability to just go to different offices. The challenge is I don't have one office. I could just operate out of one. So with that being stated, I use technology and I protect the patients by covering their eyes. And when they send me the x-ray, I have a bunch of information. Now, what I want you to do is this. The reason why I also do is this, because if our patients started to act silly and be like, I'm going to get Dr. Rendon and sue and blah, blah, blah. I have record and documentation on everything that is going on. So if something were to transpire, I could literally say, hey, Miss Jones, I know that you didn't have the best of outcomes, but Your Honor, the witness gives, or I'm not a lawyer. I don't play one on TV, but you get the point. I'd give my information to my lawyer and I'd let them know, hey, this is information that they told me. I have documentation on text. I have documentation on pictures of what's going on. It also is timestamped, because sometimes I've had patients contact me, a couple months later and say, hey, this is what happened. I was like, well, dude, how come you didn't let me know? But because how I have this record, and I have a phone that's just for my patients. If you want to learn more about that, just hit me up. So I have another app that I use for just my patients on just one cell phone. So I just use one phone, and I have different apps that I'm able to get just for my patients, so I could see timestamps, so it won't be like there was any neglect or anything like that. Because you do this after 10 years, you figure out some tips and tricks so that nobody can screw you. So just keep that in mind. And so I have the pictures, I have their open-ended questions, and like I said, I didn't get to the leading question. It's kind of like, do you feel pain? Do you have a still pain of 10? Like, that's a leading question, because you are literally pointing them into one direction opposed to letting them take it wherever you want. And if you follow these principles, you follow these tips, literally what's gonna happen is it's gonna be clockwork. Like clockwork. Like, I literally, when I'm doing surgery, I'm literally not thinking of anything. I'm just like, okay, tooth out, okay, implants in, now let's graft it, suture it, let it go. All right, have a good one. And that's literally how the procedures goes. And it's simply because I'm following these principles that I'm giving you. So if you want to learn more principles, you know, there's, go down the link below, go to smileaftersurgery.com, but I'm just throwing that in there so that you can literally have access to that. All right, and so once we get to that point, we have them give them post-op instructions, we monitor their pain, we ask open-ended questions, we got to that, all that information. All this is doing is building rapport. Like, that's the main thing when you're doing surgery. When you can build rapport with your patient, that is huge, because if or when something happens, they're gonna be like, you know, that Dr. Williams, that guy wasn't a jerk. I'll use that. I was gonna use an anatomy to describe myself, but they will say, you know what, that Dr. Williams, he's a pretty nice guy. And I want your patients to say the same exact thing when something goes bad. And it's interesting, on the same patient, she had a challenge the other couple weeks ago, and she was like, hey, I still want you to do my implants. So it just goes to show, like, life is interesting, and it can throw you a lot of curveballs. But the thing is, this is like when you literally give the best, operate your life on principles. And since we're talking about surgery, surgical principles, you can't really lose. Like, you're gonna be gaining so much more. It's kind of like if you were trading in the stock market and you choose like these crappy stocks, or you're betting on a football game and you know your team's gonna suck and you're just going off emotion. Like, expect to lose. But if you go with a winner, winners win and losers lose. And so since you're a winner, you're gonna be taking notes on these principles, and you're going to be liking, subscribing, and sharing this content with all your colleagues, because that's how you're literally going to smile after surgery. And you're going to also be helping me, you know, share with the world how to smile after surgery. And so there you have it, guys. Let me think. I got one more. No, last thing is this: follow up with your patient. That's how you really, really, really win. Like, the reason why no patients come up with me with like lawsuits. Now, I have, you know, let me make sure it's clear on this. I have been in the past, what was it, about 2 years ago, I was a expert witness on a All-in-4 case, and didn't turn out well. Patient hated the doctor simply because there was no follow-up. You know, maybe had one, but the patient needed a little bit more. And I see it like this: if you're not a concierge dental surgeon, and it means you have a practice, either you're the boss or you are working for a practice and you're at 1 or 2 locations, you have zero excuse than to have your patients come back to you, do some follow-ups. Because I gave you the digital route, I also have, you know what, let me give you a little bit more. Sideline is an app that I use. You got to pay for it, but what I do is I have another app. I mean, I have another line on my phone. I was gonna hold off on it, but I'm gonna give it to you. Sideline, I use it. You could also use Google phone, and what happens is this: you're literally able to give them that information. They could call you on there and follow up. So you have the text message, you have the phone, you have all that digitally, and it's stored away on your phone on any device. It's maybe like $10 a year, something like that. It's minuscule. Or you could just do it the old-fashioned way. You have the patient come in, document everything, take pictures with your camera, and so on and so forth. And that's how you end up doing it. So there you have it, guys. That's how you manage a patient who has swelling after one of your procedures, and how to manage it. So once again, I'm Dr. Jared Williams. My focus is for you to smile after surgery. Once again, guys, if you want to learn more, if you want to do more, I do consultations on a regular routine basis. So if you want to, go ahead and go down to the link below, send me a message. I'll give you my phone number. Just don't tell anybody. It's 281-896-0974. So text me, let me know. Once again, hit like, subscribe, and once again, my focus is for you to smile at surgery. Once again, if you don't like what I gave you, hit the thumbs down button, but just do me the courtesy of just telling me what you didn't like, so that I can hear what you have to say and push out the best content so that you can smile after surgery. All right, guys, make it a great one.